Have you ever felt that nagging little ache during a run and thought, "Oh, it's probably nothing, I'll just push through it"? We have all been there, trying to be tough and power through discomfort. But sometimes, that little ache can be a big warning sign from your body. If you ignore the pain of a running stress fracture, you risk turning a manageable injury into a much more severe problem, potentially sidelining you for many months or even requiring surgery. A stress fracture is not a sudden break like a traumatic fracture. Instead, it is a tiny crack in your bone that develops over time from repetitive stress and impact, which is very common in running. Think of your bones as constantly remodeling themselves, breaking down old cells and building new, stronger ones. This process, called bone remodeling, allows your bones to adapt to the demands you place on them. When you run, your bones experience microscopic damage. Normally, your body quickly repairs this damage. However, if the stress continues without adequate rest, the rate of damage outpaces the rate of repair. This imbalance leads to a weakened area that eventually forms a small crack, which is a stress fracture. If you continue to run on this compromised bone, the tiny crack can widen and deepen. What might have started as a mild stress reaction, which is essentially bone bruising, can progress into a full-blown stress fracture. Continued impact prevents the bone from healing and increases the size and severity of the fracture. In some cases, this can even lead to a complete break of the bone, which is a far more serious injury requiring extended non-weight bearing and a much longer, more complicated recovery. So, what should you do if you suspect you have a stress fracture? The absolute first step is to stop running and any activity that causes pain. Trying to run through it will only make it worse. Next, pay attention to the type of pain. Stress fracture pain is often localized, meaning you can point to the exact spot that hurts. It usually worsens with activity and gets better with rest. Once you notice these signs, it is crucial to consult a healthcare professional. They can properly diagnose the issue through physical examination, and sometimes imaging like an X-ray or an MRI scan. A key insight here is the difference between a stress reaction and a stress fracture. A stress reaction is an early stage, like a bone bruise, where the bone tissue is irritated but not yet fractured. Catching it at this stage with proper relative rest can often prevent a full fracture. The term relative rest means reducing impact activities while maintaining some gentle movement that does not cause pain, which is different from complete inactivity. Ignoring pain, even what you think is just a minor ache, can prevent you from catching these early warning signs. Protecting your bones and listening to your body are paramount for a long and healthy running journey. Taking a short break to address a potential stress fracture early means avoiding a much longer, more frustrating, and potentially permanent layoff from the sport you love. Prioritizing smart recovery and seeking timely professional advice safeguards your long-term running future, allowing you to return stronger and more resilient.